Today's culturally responsive behavioral health and reentry programming session. My name is Alexandria Hawkins, and I am a policy analyst at the Council of State Governments Justice Center, and I will be introducing the session. As a notice to participants, this webinar will be recorded. Additionally, the speaker function has been muted for the session. If you have any questions or comments, we ask that you use the chat or the Q&A function. Today's presentation will begin with an organization overview, followed by an overview of cultural responsivity. We will then have an overview of the panelist programs before diving into a panel discussion with our presenters. Finally, following the panel discussion, we will have an opportunity for participants to ask questions to our panelists. While we ask you to remain on mute during the session, if you have any questions, we ask you to utilize the chat function, as we will be monitoring the chat throughout the presentation. The Council of State Governments Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association serving state officials in all three branches of government with policy and research expertise to develop strategies that increase public safety and strengthen communities. Our presenters today will be myself, Alexandria Hawkins, a policy analyst with the Council of State Governments Justice Center. We will also have Rosemary Whiteshield as the moderator of our panelist discussion. Dr. Whiteshield works as a project manager with the Council of State Governments Justice Center, where she leads projects focused on centering equity, culture, and community values in policymaking. She's a member of the national team providing training and technical assistance to federal grantees. She also collaboratively leads the development and provision of technical assistance and service to tribal nations. She has worked with tribal nations and others across the U.S. in the behavioral health fields. She earned a PhD from Iowa State University in Leadership and Policy Studies and her clinical certification as a trauma treatment specialist. Next, we have Mr. Christopher Harrington. Mr. Christopher Harrington is the Social Services Program Manager for the Fulton County Sheriff's Office. Christopher Harrington is a proud product of Lakeview, South Carolina. He graduated from South Carolina State University with a Bachelor's of Science degree in Criminal Justice. At South Carolina State University, Christopher cultivated his legislative experience by working closely with the South Carolina State Employee Association. He helped determine possible legislative solutions, attended proviso meetings, and worked closely with bill sponsors in both the House of Representatives and the Senate in South Carolina. While undertaking this task, he was able to work with drafting attorneys, which allowed him to follow the bill through committee floor votes, all while making sure that the bill was veto-proof. The bill was House Bill 3999, which ensured health insurance for all state employees and made sure that all employees had the same benefits. Christopher has over 20 years of experience with the criminal justice reform and reentry transition. Utilizing his knowledge and skill set has allowed Christopher to influence, measure, and amalgamate various organizational policies. Currently, he serves as the Social Services Program Manager for the Fulton County Sheriff's Office. A few of Christopher's roles embodies Reentry Program Coordinator, Program Manager, Workforce Development Officer, Training Coordinator, Juvenile Probation Specialist, and Pretrial Release Officer. Christopher is certified in child and adolescent trauma-informed care, as well as a certified human service professional. His life work is to assist those that have been marginalized, underserved, and disconnected from their family while being incarcerated. His motto is "Be a Solutionist." Next, we have Ms. Carol F. Burton. Carol F. Burton is the CEO of the Jewel Legacy Group out of Alameda County, California. Ms. Burton is a strategic advisor, facilitator, and bridge builder and the founder of the Jewel Legacy Group, and the former chair of the Justice Involved Mental Health Task Force. JLG provides a range of capacity building services for entities serving the homeless, mentally ill, alcohol and drug dependent, incarcerated, and other marginalized populations. From 2017 to 2019, she served as the interim director of the Alameda County Behavioral Health, providing leadership and oversight of the administration of the Mental Health and Substance Use Disorder Plan for Medi-Cal beneficiaries. Ms. Burton also serves as strategic advisor to selected several elected officials and government leaders on mental health and criminal justice related matters. She has served as a drug and alcohol technical assistance provider for drug courts and county administrators. Ms. Burton is the former executive director of two nonprofit agencies. She's a trusted advisor and mentor to many and has been recognized for her strong leadership and facilitation skills. She has designed in many collaborations, including the New York Children of Incarcerated Parents Partnership and the Bay Area Children of Incarcerated Parents. Ms. Burton serves as the principal investigator for the country's first comprehensive program and longitudinal study on children and parental incarceration, and is the recipient of the White House Champion of Change Award for her outstanding work on behalf of children of incarcerated parents. Last but not least, we have Ms. Maria Molina of the Turiachiva Vo Path to Recovery Homes in Tucson, Arizona. Maria C. Molina Vasavoy comes from the Yome Talmanaka tribe. Her commitments include nurturing 6 children, her partner, community and collective healing and liberation through culture, ceremony, connection, and connection to all our relations. She belongs to Kaupoli Teohali, a constellation of families living the values, cultures, and traditions of their ancestors as caretakers of the land, water, and sacred bundles. She is a clinical social worker, standing with her tribe as the residential programs manager of the Turiachi Vo Path to Recovery inpatient residential treatment homes on the Pascayaki Reservation that centers recovery as decolonization and liberation, and of the Now Weri Utaki Hiaki Utaki Transitional Treatment Program that seeks to strengthen the Yaqui tribe one family at a time. She's an adjunct faculty member at the Pima Community College for the Social Services and Behavioral Health Department. Love, justice, and healing are the foundation of her practice and way of living. So let's begin our roll call to see who is all present with us for the session. If you don't mind, please put your name, title, and organization in the chat. We will begin by discussing cultural responsivity. Many criminal justice systems are overrepresented by communities of color and American Indian people. Studies show that Black people are 3.15 times more likely to be incarcerated than white people. American Indian people have been admitted to prison at over 4 times the rate of white Americans. Those who identify as people of color are less likely to be identified as having a mental illness, and once incarcerated, are less likely to receive treatment than white individuals. Culturally responsive skills are important for clinicians to engage clients in services and treatment. So, by us becoming more culturally responsive, clinicians and programs can improve the therapeutic relationship between clinicians and clients. Research shows that the therapeutic alliance, or the relationship between the client and clinician, is one of the most important factors in successful treatment outcomes. Cultural responsivity can also improve treatment outcomes and client retention and services. So, although there are different perspectives on the concept of cultural humility, one definition is a person's willingness and openness to demonstrate respect and a lack of superiority when interacting with those of different cultural identities, values, or worldviews. In moving towards a more inclusive and responsive treatment, agencies need to move towards cultural humility. This includes being mindful of the following: respect for a person's cultural identity, socioeconomic status, the impact of trauma, individualized needs, and client strengths. Next, we will get into a brief overview of our grantee programs that are speaking today. First up, we have the Fulton County Sheriff's Office CSAMI initiative. Fulton County was the awardee of a Second Chance Act grant on co-occurring substance abuse and mental illness in fiscal year 2019. The program focuses on men with co-occurring mental illness and substance use disorder returning to Atlanta's West Side neighborhoods. These neighborhoods are predominantly African American. The grantee serves men ages 18 to 24, and they are serving 150 people. The area is predominantly urban with over 1 million residents, 44.5% of those being African American. Some of the ways that this program is culturally responsive is by aligning the staff with the target population. The program works in partner with existing community structures to serve their clients. One of the key features is identifying community partners within the client's neighborhood. The grant partners with Chris 180 to provide substance use and mental health services and uses Atlanta at Promise Centers. The At Promise Centers was the brainchild of the Atlanta Police Foundation, which works to reduce youth crime and provides customized social services, including therapy, counseling, mentoring, tutoring, and enrichment programs to youth whose transgressions has exposed them to the juvenile justice system. Next up, we have Alameda County out of Oakland, California. Alameda County CSAMI initiative was a grant for fiscal year 19, a Second Chance Act grant for co-occurring substance use and mental illness. The grant works with the Jewel Legacy Group, who is contracted to administer the grant in collaboration with Options Recovery Services, Alameda County Behavioral Health, and Alameda County Sheriff's Office, along with other government and community-based organizations. The men served are African American, assessed as being high risk for serious mental illness and substance use disorder diagnosis. They have a history of 1 or 2 psychiatric hospitalizations within a 12-month period. The grant is serving 500 people. The program focuses on system improvement. The area is mainly urban with over 1.6 million residents with an 11% African American population. The program is developed to meet the culturally specific needs of African American men by ensuring that the providers have culturally relevant training on different diagnoses, utilizing best practice interventions for trauma-informed care, hiring a diverse staff that is representative of the population, and using providers with experience working with African American men and linking those individuals to culturally responsive post-release services. And next up, we have the Turiachiva Vo Path to Recovery Homes out of Tucson, Arizona. This program works in partnership with a Second Chance Act grantee fiscal year 19, Pima County, Arizona's INVEST program. Some notable features about the program is that they provide 24/7 residential treatment services for Yaqui tribe members and other eligible people with co-occurring substance abuse and mental illness. The mission of this program is to provide a healing and justice-centered safe space for Native peoples to engage in collective healing and recovery from substance use, trauma, and other behavioral health challenges by using therapy, community, and other family engagement and case management. The area is urban with over 1 million residents, with 4.4% being Native peoples. The program is culturally specific to Native peoples in Arizona by utilizing resources from the tribe to create collective healing and holistic recovery, and utilizing traditional Native spiritual practices such as sweat lodges, alternative medicine, access to traditional healers, and the incorporation of traditional cultural practices and ceremony. And at this point, I'll turn the presentation over to Dr. Rosemary Whiteshield to moderate the panel discussion.
Good afternoon. It's such an honor to be here with you today. And it's such a wonderful experience to be able to learn from our panelists, from their deep expertise in serving their communities. So our first question is, what are the approaches you use to engage community members that you serve in your programs? And we can begin with whoever would like to start.
Well, I'm Carol Burton, and well, we have a captive population, and so the men are when they're coming into our county jail. Alameda County Jail is one noted as the fifth largest jail in the country, and as men are coming into the jail, there is a screening process that identifies whether they have reported any history of mental illness or substance use. And then they are further screened and assessed by a medical clinician. But the real outreach means once they are back in the housing units, they really have to self-select. And so we reach out. We can reach out through iPads, but they are deciding that they want to follow up, and they're mostly it's word of mouth. Are they a trusted provider? Are they a provider that is known? Are they known to serve African American men well? And so we use a community provider inside the jail that it has a reputation of providing comprehensive services, residential and also treatment services to people who are returning home. And so that's at least two different steps that we use to recruit and engage our population.
Thank you so much.
Mm-hmm.
Good afternoon. My name is Christopher Harrington. And just like Ms. Burton stated, usually during the intake process at the jail, we monitor the individuals that come in. We have a great relationship with our jail administration. The captain of programming, she usually vets the potential participants. And from that phase, we move on into our vendors, which is one of our community stakeholders. They do an awesome job of making sure that our participants meet those criteria, as well as we have a proven track record. Some years ago, we started the Smart Reentry program, and our recidivism rate then was probably about 0.4. As to date, with the persons that have been released through our program during this moment, our recidivism is at 0. So we have our great partners in the community. We have the Atlanta Police Foundation, which operates the Atlanta Promise Center. And at the Promise Center, that is where, again, all of our things are word of mouth as well. So we come together with the community to make sure that we offer these programs within the jail. And as you heard in the beginning, we are dedicated to certain zip codes. So there are 3 zip codes that we monitor and we service. And a lot of times those guys are the real persons when that word of mouth, when they get out and they say, hey, we had an opportunity in jail to have a form of behavior modification, a form of some self-help, some check, and some people that are intentional. As for us, we are in a unique situation here at Fulton County. Our staff is predominantly Black. Our inmates are predominantly African American, but our intentions are great. We make sure that the deputies that we work with on our pod and our floor, our captains and our lieutenant captains, and even the young lady that we have as a lieutenant on the floor, she does a great job of making sure that these young men are cared for, make sure that they have some accountability, and until that's usually how it works for us. We word of mouth, our intake phase, what we do in the community, and our stakeholders. And together we make sure we try to really wrap our individuals in jail so that when they get out, they are able to adjust to the community, so to speak, try to maintain some gainful employment, and be better persons for the community once they're released from jail.
Hello, my name is Maria Molina. I'm out here in Tucson, Arizona, what we know as Chukshan, a land of the Tohono O'odham, Yoeme, Apache, and several other indigenous peoples who have, set up shop and lived out here in this area. So I just wanted to say that. For us, so our program, our residential programs, we have a male identified, female identified inpatient substance use treatment. And so we're very fortunate in that who we are as a behavioral health entity and as a treatment program was built by us to serve our own people. So we're out here on the reservation, but we also have different pueblos in Arizona. So we have our reservation, we have our old Pascua community, we have, going north towards Phoenix, we have Marana, we have Guadalupe, we have a community in Benjamo. So we're kind of scattered throughout different areas. Being on the reservation is where everything is, right? So it's our administration and all of the different services that we provide. So, we work really hard to connect with our community members by being out in the community. We have staff working here now that have been participants in the program, who have gone through a peer support program and who have been stationed in other departments, but who now go out into the community, go to the MAC clinic and just engage with the community and let people know, hey, we're here and that we're ready to provide services when people are ready to come into treatment. And so it's really easy here on the reservation. We make sure that our pretrial services, our prosecutors, everybody has pamphlets. Our Pascua Yaqui Police Department carries pamphlets around. Like we invite to be able to talk to different teams so that they can get to know. I think for me as a program manager is making sure that people know who our staff are, because our program has been here for a really long time. It's changed hands. It's been kind of, recycled, and people have tried different approaches. For me, it's really important for people to know who our staff are as human beings so that they can get to know faces and engage with the community. Because when people get to know, we have amazing staff. When people get to know the staff, then they start feeling comfortable to come and receive services. And so the trickier part is trying to do outreach to the communities that are a little bit further away, because we don't get to have that person-to-person engagement with the community, but they do have our information. We get referrals from other tribes because we also provide services to tribal members from other tribes. So we just make sure that they have our contact information and just update them whenever we are trying to provide different kinds of services or we're trying new approaches here, just to try to make sure that people understand kind of like the culture and vibe that we have here, so that people know that they're safe and trusting to come spend time with us. So I think that's the biggest part for us, is getting our staff out into the community to be visible. And, we just started up a Facebook page, and I'm really excited about it, because for our, we have our behavioral health Facebook page, but we also have, we wanted ours to be separate, because I think for our program, we like it to have more of a grassroots community feel than for it to be, behavioral health, using behavioral health, that proper language. We use more harm reduction approaches, and we really center community and our tribal community. So I'm kind of excited that we get to be separate in that way, because we're very justice centered. So we want to have that type of communication out to the community too.
Thank you so much. I'm really struck by how all of you utilize cultural strengths within your community to improve engagement. And also, as we know, centering culture in all that we do really improves outcomes. Thank you for sharing your wonderful expertise. Our next question is, are there specific culturally affirming methods that you use in the screening and assessment experience to reduce re-traumatization?
I can go. So unfortunately, that's just one of the pieces of getting people intaked into the program, is having to do a general screen at first and then, getting them into our behavioral health services. So then having to go through the assessment. So, and it's kind of unavoidable at times, but we do, the part that I think is the piece that's really important is to talk to them and explain that we're not wanting to create a space where you're having to be, kind of retell your trauma, that we're trying to avoid that. And we're needing to get these pieces of information. So how can we get these pieces of information without taking you to a place that we're not in the moment? Like, that's not the intent of it, right? So what we find is that when we have really good communication about what our intentions are and what we're trying to do, people are really receptive to it. We have peer supports here. We're really fortunate. We have peer support. So we like to make sure that people, if they want somebody in when they're doing the screen or when they're doing the assessment, they can have that. We have our cultural leaders here also. So we just like to ask the questions off the bat, like what's going to make this most comfortable for you, and like what things can we get done to get you to where you need to be, in a way that, yeah, it's like you're not being poked and prodded almost, it feels like, right? When we do get referrals from our behavioral health programs, I kind of like to do like a no questions asked. Like if you're being referred by the court and you have charges that are related to drug paraphernalia or possession, we're not going to question it. I think that we have key indicators of when somebody is struggling with an addiction, and so we just take the referrals without having to do unnecessary screening processes to get them here.
Yeah, thank you, Maria. That's so important. And it reminds me that one thing that I didn't say is that the Alameda Project is a collaboration between two county entities. One, of course, is the sheriff and the jail. And the second entity is the county behavioral health system that delivers the mental health services and treatment services inside jail. And then the third entity is our CBO partners that come into the jail to, some of them deliver direct service and others are planning for the release. And so jail itself can be very traumatizing. And when you think about the number of times professionals ask those questions over and over again, that in itself is re-traumatizing. So the screening actually happens. It's part of the jail screening. So everyone that comes into the jail has some demographic information that's collected, descriptive information. So the screening is really a paper screening. And so we're not really asking any questions at that point. It goes to a mental health professional who, what we are finding is that many of the men have been in our mental health system or treatment substance use system, disorder system at least some other point. And so we have some information with some of them. And so there's no need to ask that second level of questioning before it gets to our options team, which the options team will, over a course of 2 to 3 meetings, gather information. And so the first meeting is really just getting to know and helping the men to feel comfortable, asking things about what they're concerned about, because they have been motivated enough to respond to a call out or request some support. And so there is some interest. And so the clinicians have, from options, have decided that they're not going to just go right into the assessment, which we're using the GAINS tool. One thing we also added on to that was the discrimination assessment, and asking about the number of times that they felt discriminated and felt racism. And so that has been, I think, another way to help men really to heal, begin to acknowledge that there's been layers of trauma and pain, and begin to heal. So I think it's really important to be careful about that in the beginning. One thing we've learned is that a significant number of them have, within the last 30 and 60 days, 90 days, have experienced some extreme loss, trauma, and violence. And so the screening process is even more important. And also, I just want to say that the behavioral health department has what we call, I'm pretty sure everyone's familiar with the CLAS standards, which are cultural, linguistic, appropriate services. And that all of our staff and our contracted providers need to be trained and aware of all of those standards, and also are continuously receiving training each year. So I hope I answered the question. I got excited as Maria was talking and listening to some of the approaches that they're using, and I kind of lost the question, but went straight into that excitement. So thank you.
Yes, you did. Thank you.
Hello?
Yeah.
Yes. And just to kind of follow up with what Ms. Carroll said, for us, yes, we do have the screening. But most importantly, I think what is unique to our program is the age group. We are serving 18 to 24. So there is some trauma. First, coming into jail, there have been many times a lot of these individuals have had charges upon charges, but never had to come to jail, never had to sit down. So we look at it as our staff being very diverse. And as for myself going in, I can't change who I am. So I walk into jail every day as a Black man. But what I am intentional about the services that they're being provided. I'm taking it upon myself to make sure that I try to speak with each individual that comes into the program. Our staff, our therapists, we have 3 African American and 1 Latino. So we are very diverse in that. Our accountability, we make sure that we try to reduce the re-traumatization by allowing the individual to be themselves. We are very intentional about what we say and how we go about doing our curriculum and our classes. We make sure that we tell them the choices don't define you. You know, moving forward continues the narrative. We have trained jail staff and therapists and case managers who understand you. They see the world through the lens in which those young men that are represented in there. And for me, I make no qualms about it. We are trying to get men back into the community. Right now, if you see on the news, we have an uptick in all kinds of crimes. So again, those young men that are in there can be somewhat of a deterrent if they get out or when they get out to say, hey, fellas, this is not the way to go. But we make it so where they have an opportunity for thinking for a change, and with the matrix and behavior modification. I mean, along with our partners from our APS with our GEDs, we have a Black teacher that comes in, our workforce development crew. We are very intentional about making sure that they are able to get out and use what they have in the community. And here's the one other thing. It's like a two-way street. So again, what we learned from our previous partners or previous persons that come through jail, we apply to the next individuals, because again, there's so much in age, so much of some of the same thinking, zip codes. I call it the basic needs trauma. And these guys, a lot of them are at the moment where somebody has to care and give them a second chance and give them a second chance about caring. A lot of times it's hey, you did this and people move forward. But for myself and all of our staff, okay, we got a second chance, but we're going to hold you to the second chance. We're going to make sure you're accountable and we're going to check on you each and every day. So again, I make myself visible. I allow the staff to do their jobs, but I go into the pod myself daily to make sure that everything is okay. Because again, I represent those young men that are in there, and I represent the community in which they're coming out. So I want it to be a great marriage of everyone that is involved. So that is what we do in a nutshell as far as our screening and assessment and experiences to do away with the re-traumatization. Because again, even in this pandemic, it was hard. We had to pivot several times. There were I mean, even with the cultural disparity of having the vaccine, that dealing with their family on the outside, not being able to get in contact and not knowing where people were. So again, we found ourselves, whatever that is we could do to make sure that our individuals were in the best mental state that they were in, moving forward. So that is what we do with our experiences of re-traumatization.
Thank you. I'm really taken by the beauty in all of your programming and how you approach it, that the screening and assessment isn't only for placement diagnosis, but it's an immediate invitation to help people heal and improve their quality of life from the very beginning. In moving into our next question, how do you select practitioners, staff, to help serve the community members that participate in your programs? What are the things that you look at in terms of bringing in culturally responsive staff and practitioners?
I think I'll go because working in prisons and jails is a culture in and of itself, and so the culture or the mission and the purpose is care, custody, control, and care, and so understanding first whose house you're in. And then identifying partners who are willing to work together. I want to say that inside the jail, we're fortunate to have deputies and folks who are assigned to the project who want to be there, who believe in transformation, who believe in healing, who believe that mental health and wellness is important and treating the whole person is important. And so that starts from the custody side. And then the professionals who come in from behavioral health, who deliver the services inside, are also folks who signed up for it. Yeah. They signed up for a job inside of a prison, of a jail, of a locked setting, and so had some recognition of and experience and knowledge and history around the populations that find themselves who have greater disparities and rates of incarceration. So they had histories of that and knowledge of that, and knowing that it would be inside of a totalitarian system where it was, it was the doors are locked at night and throughout the day. So for the I think the governmental partners, they had a choice in what they wanted to do, and I think they came because they were concerned about this particular population and all people getting the kind of support they needed. Our CBO partners are it doesn't take long for people who find themselves utilizing mental health and substance use treatment services. It doesn't take long for the word to get around, and that if you have a reputation of being a good partner, someone who sees me as more than my disease, more than my health, more than the decisions I've made. It doesn't take much time before that word gets around. And I want to say that the folks who work with options are folks who really have a heart for the people, and a heart for healing and recovery. They also are really well trained. And I say this in full transparency. I did do some support, some work with their organization, so I know the insides, and they really take this seriously. So, and it shows up in the reputation, and so I think that making sure that the people who are doing the work want to be there, and that they're there for the right reasons. They're not there trying to save someone from their sins. That they see people as more than their health, and they see them as more than the crimes that they commit, and that they're all willing to be flexible. Because sometimes when you're in a locked institution, you need to be flexible. We need to be flexible if we're going to do what we said we were coming to do, and that was to serve African American men who are experiencing co-occurring disorders. So, and the last thing I would say is that our grant is a self quality improvement, a system improvement grant, and it really is designed to figure out how we can improve the way that things are operating. And I'm really excited about the things that we've done and put in place to do that. So I'll just stop.
Thank you.
Okay, I can go. Okay, so for us, like when considering who will be providing services here, we have out of probably close to 35 or so staff at one point that were therapists. There was only myself and one other person who are tribal. On our management team, I'm the only tribal person. So we don't have, and at one point I remember they were trying to start a program for people to get behavioral health certification, but the people that had interest were, because of their background, would have been difficult to get, fingerprint clearance cards and things like that. And so there's not enough tribal people, anywhere in the world, because we had kind of gotten sent off to reservations and different areas of town where we didn't have much integration historically. So we have, there's just so many unique needs that we have here that a lot of people who come from the outside might not understand. And that includes even tribal people who don't live on the reservation, have a different experience. And so there's a lot of complexity and in our identities, the level of acculturation, assimilation that we've experienced. Like there's just so many, it's just really complex, and so when people come in, they'll want their therapist to be tribal. They'll want a tribal member because they're going to want people to understand. But then on the flip side of that, in tribal communities, there's a lot of distrust in behavioral health, especially with people who are tribal, because they worry about their information, getting out into the community because there's like a reputation on. And I'm gonna say I'm speaking for myself and my experience here. I'm not speaking for all tribal people everywhere, but the experience could be that there's a lot of talk. So if somebody sees somebody walking over to the behavioral health building, they're going to tell everybody and all the grandmas, right? And everybody's going to know. So there's kind of like two pieces to it. People do really want to be connected with somebody who understands their needs, but then at the same time, there's that fear of, people talking about them and people telling other people their business. And so for me, what's really important is to have kind of have both things, have people who are tribal people, trying to let the community know that the staff that we have, you know, we really invest in them because of the integrity that they have and how they're committed to working and serving our tribal people. And so definitely don't want anybody here who's like a firm believer in bootstrap mentality, you know, because like people need to have a critical awareness about what's happened to Indigenous people historically and the socio-political realities that exist that keep us in this oppressed state and create all these barriers for our people to succeed. So I mean that there's, you know, certain I guess it's kind of hard to assess, right? Like when you're doing an interview, but like really trying to get a handle on what people's values are when it comes to being individualistic versus collective, like understanding, you know, understanding the impacts of historical trauma, not by just looking at a list of symptomology, but how that plays out. If you come to work here to be a therapist, you have to understand that you're not gonna, you know, there's a lot of putting fires and crisis every time people come in. So like there's a different way of having to work here. So like their values around, you know, being individualistic versus being collective, or like understanding, you know, centering people's culture and language, you know, like not being so focused on using clinical language, but really working from the perspective of what the person is experienced, like whether it's like spirits, medicine men, and using that kind of language. But then, yeah, like trying to weed out people that can do harm, you know, and can do harm because of the paradigms that they have. And, you know, sometimes people unintentionally cause harm by having certain expectations of tribal people, the way that we function, what our values are, and what we identify as, you know, for ourselves to mean success, health, fulfillment, joy, all of those things, right? And for people to understand that because of the relationship that tribes have had to the federal government historically, there's a lot of, you know, entitlement sometimes from tribal members who expect certain things because of, you know, some of the very limited resources that we've received as tribal people. And so sometimes that can create like a very low bar or very low standard that people strive for, because those are kind of like the bare minimums that are being provided. So there it creates like just like a whole lot of layers to kind of work through, but definitely want people here who are understanding of, you know, what recovery means now versus, you know, when it came from the NAAA movement, you know, like making sure to use the appropriate language, you know, like and not labeling people, you know, not being so abstinent focused, using harm reduction principles, people who are wanting to be allies also, who are willing to learn about our struggles in history, but then in the context of what it is to be an indigenous person today. So people who are have that willingness to practice cultural humility and then to stay justice rooted, knowing that like when somebody is talking about an experience of racism or colonialism, we're going to validate that, and we're going to go over there and we're going to try to make some corrections, because we know that that's the world that they're going back into. And we can't have people that are just wanting to be in an office. You know, cultural humility means also working towards change, you know, and those are the kind of people that we want here. And so when we say, you know, centered in love and justice, it's like, you know, that's not the language that you hear when you go to school and get trained, you know, those are like taboo words. But like, no, that's not how we roll as tribal people. And so we're going to use the language that we're used to using. And so if people are wanting to and willing to adapt to that, then we're happy to have people here.
Thank you so much. What you said is so close to my heart, and I think to the hearts of so many of us that are attending this session today. I think healing historical trauma and current trauma and decolonizing the clinical practice approaches are just essential in culturally responsive approaches. Thank you again so much. We'll be moving shortly into taking questions from our audience, but I really wanted to ask Christopher if he wouldn't mind weighing in on this question, and also leading into our final question is, can you highlight the priorities from your expertise and experience new sites
Okay.
that are considering developing and implementing a new culturally responsive program in their community? And do you have any additional recommendations for those interested in culturally responsive programming in general? So if you wouldn't mind, if you could respond to our last question and then move into our final question, that would be wonderful.
Thank you. Thank you. Yes. It's kind of like Ms. Carroll said, well, you have to know that you're being invited to someone else's home. We know the jail culture, but again, here in Fulton County, we are very unique. Again, the people that are there as jail administration look a whole lot like the people that are in the jail cells. So our staff, the jail staff, the captains, the lieutenants, they are very much having that intentional do right attitude. We have a pod that is created for our programs. Our captain of programming has been with us since inception. She makes sure that her staff is trained. And even moving into with our vendors, we make sure that we accept who they are. And you got to use all your cultural experiences inside there working with those guys. Make no qualms about it. You know, you got to be an active listener. You can't be afraid of the jail setting. And you got to check your ego at the door. You cannot be judgmental in doing this. And you gotta love to do this work. You got to be called to do this because again, we're walking into a place where once we go in, we're locked in, and we're let out at a specific time. So you have to have awareness about you. You got to be able to be honest. A lot of the guys, they'll come back and tell me, Mr. Chris, this person not working. You know, because again, they know who is here for a check, and who's there to make sure that they're receiving the services that are needed. So that is, for the most part, what we do. I make sure that I speak with the vendors that we use on a daily. I check in with them. I check their temperature. I check to see how's your day. You know, where are you? I go up on the floor before programming, after programming, during programming. Again, to make sure that we're in a space where the guys know that we are serious about caring and making sure that they get back out into the community, and be a part and be productive. Make sure they get back to their families, and make sure also is being able to practice what they are learning in the jail. The behavior modification, and like I tell them, it only works if you use it. If you use it, so that is the way that we do most of our training and vetting our vendors to go in. And with the second question, what are the
Tips do you have for people that are new to integrating culturally responsive programming or starting culturally responsive?
Oh, you got to know your target areas. You got to know who your stakeholders are going to be. You got to identify your project goals. You got to make sure that your deliverables or services are true. Make sure your community is a part of your implementation. Again, you got to reach out to nonprofits, faith-based organizations, the private sectors. You got to make sure that everyone is on board. You know, you create action steps for each stakeholder. You know, everybody has to be in this in order to make it work. That's what a community is. Again, we're on the west side of Atlanta, and again, I have had the opportunity for a lot of my matriculation through my career to have worked with and in this area. So again, for me, I have seen the work. I see the work of nonprofits and and private organizations and entities really coming together. And I look at it now as like we're in this age of high crime, but also we're looking into the ways of criminal justice reform. We're at a unique space, a very unique space, to again work on some new social services. Again, there's nothing wrong with what we have done, but cookie cutter right now may not get it. I mean, the world has changed. We saw that with COVID. We saw that we have to shift, we have to pivot. So you got to be mindful in everything you do when you making a program. You got to make sure that the location is good because everybody doesn't have a car. So you got to make sure you got some type of transportation where they can get to their meetings, they can get back and forth to jail, that they can have an accountability piece and won't be held, to say, hey, you didn't get there. But now you're able to get on a train, you're able to get on the bus, and give them those services. We got to make sure that we're able to meet each and every individual where they are. There might be some family training. It might be some workforce development for mom. He might be with grandma. Grandma might need to be able to make sure that she's able to get her medication and eat so that this young man or young lady doesn't go back out there and commit the same thing that put him back in jail. And those are the biggest things that I say as I'm looking, make sure that the programs and your implementation stages work at its best. Create a community, create communication with stakeholders, make sure you're going to know what your deliverables are, your goals, and reach out. Again, being able to know that there's some organizations that we can call on at any given time for any specific thing we may need for our clients. That works. But you gotta keep those relationships. You gotta be out in front of it, and you gotta be true to what it is you're trying to do. It can't be about money. It can't be about I have a grant, I have a program. None of those things. You got to be true to it, true to your heart, to make sure that it works and it works well for who you're serving and the community.
Thank you so much. The specific suggestions for people that are new to integrating culturally responsive programming, I'm sure will be so helpful to so many. Thank you, Christopher. As we're closing the panel discussion today, I wanted to ask our other two panelists, what would be their suggestions, recommendations, and advice to those who are interested in integrating or beginning culturally responsive programming?
Okay, I could go. I'm trying to notice the time. We're done at 1, right? Are we okay. So I'm gonna try to be quick. I think it's important to know that there are often several attempts by outside people to come into communities of color marginalized community with like a fix it, right? And then so there's already some distrust there because there isn't exactly follow through. Here in Indian country, we get a lot of doctors, interns, people that come get their hours and then they leave. So there's a whole lot of abandonment that kind of keeps happening over and over. And all the while, the community has been able to maintain community care. And the reason for that is because we have our people. Different communities have, people in their community that are the healers, that are the midwives, that are, like the caretakers, the nurturers. We have people in the community already. So just making sure that you invest in those people and making space for them, for the work that they're already doing, and, pay them for the labor that they're doing, pay them for their labor and center the expertise that they bring, and make sure not to appropriate, don't culturally appropriate. That's something that happens often. And just understand that there's people already there that are doing the work. And so, and just making sure to center them. I think every community has its strengths already and is full of resources. And like, we just have to remember that most people who are incarcerated are oftentimes they're unjustly, because like we're not looking at the context of the life that they grew up in, all the barriers, poverty, like all these different things that, shovel people into the system to begin with, you know, and there's a lot of wounds there. And so I think just centering the community, centering people in the community that have strengths already, and pay them.
Thank you so much. Carol, would you like to, we have a couple minutes left before we take questions from the audience.
Sure.
What would your advice be, your recommendations, suggestions?
Yeah, I would ditto and just underscore what Chris has said, and also um, Maria. I think that there is the social and political context that folks need to do their work, their homework, before attempting to work with our population, particularly African American men and African Americans and indigenous folks, first generation, First Nation. Just understand the history and the political context which people live their lives. I think looking at the data too. If the data isn't there, ask for it to be disaggregated so that you can understand the populations that you're going to look at. And also going to the community. Going to the community to understand what they need. Sometimes when we get these grants, we write because they say that you need to do A, B, and C, but that may not be the best approach. And so do your own research. I want to say operate with some humility. You don't know. You really don't know, and you won't really fully know the experiences of folks that you're serving. And also understand that you don't know all the things that have happened before, the failed attempts or other attempts. And then I wanted to say that consider peers, hiring people who are personally impacted. Consider that first, and the kind of supports and training and funding. I fully agree that they should be paid. And then spend some time with the training and learning. Understand that's going to be a constant. Get good supervision because people who sometimes are traumatized are challenging to work with. And so you don't want to do any more harm. Our goal is to first do no harm. So make sure you have the training and the supervision that's needed. And then I would say just partner with other organizations who do this work well, particularly if you've never done it.
Oh, thank you so much. What strikes me about all of the caring that you have for the people that you're serving in your communities, from my view, will extend generationally the impacts that you're making with your leadership. Thank you for letting me spend time with you today. We really appreciate your leadership expertise and all the wonderful things that you share that will help so many. I'd like to turn it over to Alexandria now, who'll be taking questions from the audience for you all.
Thank you, Rosemary. One of the first questions I saw in the chat is what is the preparation of local municipalities, such as police, for reentry initiatives? Without their inclusion, is reentry doomed to fail? So, Carol, did you want to take that question?
Sure. We in our county and in a lot of counties in the Bay Area, Northern Cal, they have collaborations where you have law enforcement, you have probation, you have your local sheriff, you have your law enforcement agencies, you have your district attorneys, you have your system providers, medical providers, you have community-based organizations, and you have people who are formerly incarcerated, all at the table, helping to inform what those strategies should look like. And every year they're coming together talking about priorities where, well, okay, we have this much money. Where should we put it? How well did we do last year? And so in some ways they are working to hold each other accountable, but also providing the training. So, you know, that's a short answer. I think the question is really getting to something a little deeper that we don't have time to go into, but we do have some structures in place that could really, and I think in some ways are really moving the needle in that area.
Thank you. Chris, would you like to answer that question as well?
Repeat the first part one more time. I know I heard you correctly. I want to make sure.
Oh, what is the preparation of local municipalities, such as police, or et cetera, in reentry initiatives? Without their inclusion, is reentry doomed to fail?
Yes, we need all municipalities. Again, I think back to some of my earlier classes that I took in school, community policing. I think that works tremendously in the favor of what we are dealing with is this systematic uh, approach to young men of color going to jails. I feel like we need to have more persons that are in the communities that represent what you look like, um, or either have had skilled training. Because again, there are some things that you can de-escalate and you can have it, disperse a crowd or, move persons along. But again, with municipalities, they are the key that drives what goes into the jails. I mean, they are the first responders. Um, they are the ones who either citations or any things of that nature. So again, yes, but I think it comes with training. I think it comes with some mental health training. I think it comes with some civilians sitting at the table when decisions are made. Again, like Ms. Carroll said, we have a blueprint. I just think we need to make sure that we were able to, as I say, I like to say, fill in the make some of the area gray. I know it's black and white, but there's some things that sometimes within policy that we can definitely use to uh, lessen the blow to the harm of families and underserved communities uh, and persons of color. And so, yes, they need to be at the table along as with other stakeholders as well. But police first and foremost. I mean, and I know their job is very hectic, and I know that they have, they're at the end of the day they want to make it home too. But also these gentlemen that are in jail, they want to be able to get home as well. They want to be able to get their lives back together. So I think it works hands in hand. But we definitely need the municipalities involved.
Mhm.
Thank you so much. I'm gonna go to our next question in the chat. Um, what are your thoughts on justice impacted individuals who exhibited violence behaviors while in prison, whose sentences expire and they may not be mandated for treatment upon release? In most instances, this individual faces significant barriers. I guess so. This person is asking, like, how do you get this person involved in treatment?
Whew. Um, well, I want to say that uh, for the most part, when we find people sitting in our county jails, they're sitting there because the systems have failed them. And that we have, for whatever reason, did an inadequate job early in their lives to intervene to provide the kind of protections that they needed. We've been involved in the sequential intercept mapping process in this county for 5-6 years, and we have mapped out ways that people early in their lives get trapped into this kind of cycle in and out, and never get the kind of treatment they need. And so when we talk about adverse childhood events, trauma, we know those things happen to people when they're young. We need to care enough to take care of that. So on the other end, when people are leaving, and some of those folks have said, I don't want treatment, sometimes it's because it's a stigma. You're ready to leave. often, I've seen this in prisons more than jails, that means that, you know, you have a label, and then you have a few more restrictions leaving than you would have coming out. And so it's best to engage people early in the process. And so in terms of, do we court order people when they're coming out? Well, generally, sometimes if they're on parole, there is some stipulations around that. If you're talking about people who don't have tails, as they say, then I think it really takes those careful messengers, peers, and people who are trained to help engage them before they leave.
Great, thank you. So we'll bring the slides back up. Thank you all so much for participating in the question and answer period. So just to be respectful of everyone's time, I just want to make sure that we close out on time. So, oh, Corey, we can bring back the slides. Thank you. And we will go to the end.
Yes, they're uploading right now.
Okay.
1 second. I'll get on the screen.
Um, are we at the, there we go. Okay, and so I just wanted to show you all the sources for today's, resources for today's presentation. And lastly, thank you all for participating. I want to say a special thank you for the panelists for discussing their program. And you can see the remaining programming for Second Chance Month by going to the National Reentry Resource Center.org. Thank you all. Have a great day.